Again, my name is LaTonya Bynum, and what I really want to do is kind of walk you guys through the process of becoming a certified community health worker. In this presentation, I'll also show you a website that we've developed for the Florida certification process for community health workers. And I'll also tell you a little bit about the duties, roles, responsibilities. And, as I'm talking, feel free. This is very informal, but I'll be monitoring the comments as I go through the phone, and also just talking to you guys about, community health worker. So first of all, I want to give a good shout out, a great shout out to Miss Venice, who actually reached out to me and asked me to help with this project as a contractor for the Florida Department of Health in Seminole County. Also want to give a shout out to Alicia, Keisha, Haronda, Bridget, and Kendra for allowing me to work with them and also learn from them about what it's like to serve in the role of a health ambassador, community health worker at the in Florida. So I have to be honest, I'm here in Arkansas. I'm in Conway, Arkansas. And so, just working virtually to connect and also work with the ladies on getting them set up for the certification process. It has been exciting because most of the work has been done just through technology. And so, COVID-19, I would have had to either fly or drive to Florida just to do this work. And so this is possible through technology. So first of all, thank you guys for joining. Thank you to the people who are listening in. So I'll just go right ahead and get started. So a little bit about me. My name is LaTonya Bynum, of course. I actually worked at the Arkansas Department of Health in Little Rock, Arkansas for about 13 years. My first role when I first started out at the health department, I was a secretary. And so I needed experience just to get my foot in the door. But I think that really was my initiation into being a health ambassador. I would always go home and tell my mom and dad, my family members about public health. And they were always like, what is public health? Like, what are you talking about, Tanya? And so just recently, 16 years later, now they're getting a taste of what I've been talking about all this time, because public health is in the forefront with COVID-19. So everybody knows about public health, and they're finally starting to see the value of a public health worker, and not only that, a community health worker. So one of the things that I noticed when I was at the health department is that there's a special niche for a group of people who can break things down into simple terms. And I would say that's a community health worker, And so if you have a story of maybe somebody in your family who's had a health challenge, and also a personal story of how you've been affected by maybe a chronic disease, also, stroke, diabetes, anything, high blood pressure. And just to be a little transparent, I was diagnosed with high blood pressure, but I got my life together and I said, I don't want to stay on this medication. I'm going to reduce my stress. So my blood pressure was triggered by just overwhelming stress. And so once I got my stress under control, the doctor was like, you don't have to be on these pills anymore. Your blood pressure is 120/80. So fast forward to the community health worker. What we're doing here is you're the boots on the ground. You are the person that the face of public health, the face of the health department, whether that be at the state level or at the community level. But you take the information that you're learning through your trainings and also through your certification, and you're sharing those personal testimonies. You're sharing resources about programs and services. And what a great presentation earlier about, how to stay healthy and how to join some of these programs. And so just being able to break that information down in the simple terms, because you are the go-to face that they see as far as public health goes, that is your role. So that's just a little bit about the community health worker. We're going to move into the certification process. And, honestly, I told Miss Venice, I was like, Miss Venice, I am really like a health education guru. I really thrive on getting people to pass the CHES exam. And I was like, I don't know about this certification. I have some angst against actually doing this work. And she was like, oh no, LaTonya, you'd be great at it. So I was like, okay, well, if you believe in me, I'm just gonna go for it. So, you know, we've been working together for probably about a month and a half to kind of guide the process. And so what I've come up with is a 3-step process to get everyone certified. So to take you from the process of being a health ambassador, which is telling your story, sharing resources with the community, but transitioning into becoming certified. And so what we want from this initiative is, and you can see it in the polls, we're asking you to share your contact information so that we can have more certified community health workers. And this really speaks to the fact of there's a set of standards. So there's some training, there's some work experience requirements that are going to be needed so that you are always equipped with the most relevant, most current tools, resources, programs, services, and most of all, evidence-based interventions. And so we just don't want to be out here sharing things that our grandma and our aunties and people in our family have told us about public health and how to stay healthy, but we want to be on the cutting edge of what's going on. And so this certification really allows you to do that. Step number 1 is really just setting up a user account with the Florida Certification Board. And so that process is very simple. You just log into the website and go through the prompts. And I believe Ms. Venice will want me to say that she is actually working with at least 10 community health workers to help them with the certification process. So that comes with a payment. So you guys want to definitely reach out to Ms. Venice and ask her about that funding that's available. I believe right now we have about 6 more spots available. And so you definitely want to get with Ms. Venice and say, hey, I want to certify, I want to be equipped. And so once you go through that certification process, uploading your documents and creating a username and password and actually paying the $50 fee, your next step is to start working towards compiling your documentation. And there's actually 4 forms that you have to fill out. So I'm going to walk you through what we have available here. So on the Google Drive, once you click that step number 1, you'll see a couple of documents. One is a professional recommendation document. Another one is the training certification where you have to get at least 30 hours for each of the 6 domains. And then there's a form for work experience. So you have to have at least 500 documented hours in order to sit for the certification exam. And so that's a little bit about the forms that are required. So once you actually pay the application fee, you have a year, 1 whole year, 365 days to actually go through the process of getting your documentation taken care of. So step number 2 is really, you know, what I talk to my students for these who are aspiring for the Certified Health Education Specialist credential. I'm always working with them on time management, project management, but then just keeping them on schedule, because after you get so excited and you want to do something, kind of like Alicia talked about, you still have some work to do. You know, it's fine to set the goals, but are you going to really work on that? Kind of like me, like, hey, I said I want to lose weight, but am I going to get up and walk, you know, in my backyard and do something about it? So what I've designed for step number 2 is a set of project and time management resources. And the goal of these resources is to help you keep yourself on track, because, you know, along with life, work, school, you have so many things going on, taking care of family. You know, some of us are homeschooling, trying to keep our kids on track so that when the school does open back up, that they're ahead of the game with school. So you definitely want to check out this hourly, weekly schedule just about 2 months ago, I implemented the hourly schedule. So every day of the week and every hour, there's always something that I could be working on. And also just documenting the process for how many things that I'm accomplishing. And what I'm finding out is high performance. And then also I can look back at my schedule and say, oh man, I was really doing it. I'm really doing great as far as achieving my goals. And so I definitely want you to have that as a resource. And then also with the Excel spreadsheet, there's a list of about 10 to 12 things that you have to do in order to complete the process. And so just having that list is kind of like that to-do list. I love working from to-do lists. I don't know if you guys do, but to-do list is like, man, I have so many things to do in a day, but you want to prioritize. Like, you got to get up and go to work and, take care of your finances, but also what things are you doing to prepare for that next level of your career or your life in itself? So definitely want to point that out, that we have a project management schedule so that you can actually see your progress over time. Like once you've completed the forms, the documentation forms, and actually preparing for the professional references, and then going into the work experience and getting that documentation. So every step, like you're getting closer and closer to your ability to be able to sit for the exam. So that's going to be a great resource, not just for the exam, but just life in general, to keep you on track with all of your activities that you have going on while you're trying to achieve the certification level. So the last, this step 3 is really, just uploading the forms back into the user system and actually, setting aside a time to schedule your exam. And so I've reached out to Miss Daphne with the Florida certification board, the Florida Certification Board. And she basically said, once you have all your documents uploaded, you set your user account up, you'll be assigned a certification specialist. So that person is there as your point of contact to kind of help you make sure you got your documentation and you're ready to go for the exam. And so shout out to Miss Daphne. She said that I can mention her, and she's a great resource working from home as well. So what we have here is, with this contract, I was like, hey, I want Miss Venice to know that I am so excited, and I want her to also be able to share some of the findings and some of the information that we learned from this experience of working with the 5 ladies that I'm currently working with. And so in this folder, you'll also see there's a technical assistance report where you can find more resources as far as like how to set up a LinkedIn profile, how to actually navigate train.org. So there's a lot of resources that are identified in this report that can be useful, not just for the training, but then also for your career. So it's not opening up, but definitely click step number 3 and you'll be able to see that report. Not step number 3, but the resource bullet on the page, and you'll actually see that report. And then also, this is what I've talked about for maybe a year or so, just the understanding of bartering and trading. Now, I don't know about community health workers, but for health education specialists, especially in Arkansas, we don't get paid very well. And so we find that the epidemiologists and the biostatisticians are killing the game as far as salaries. And, in Arkansas, we have a transparency database, so you can see all of the state employees' salaries. And so, you have to get in this mindset of how are you going to supplement your income, stay happy, do your work, and also do goodwill. So I'm always in this mindset of make a difference in public health, but then also make you some good money. And so this last resource on the page is a barter, trade, and invest program, where I'm really saying that, a lot of times you might be working with the church and they're not able to pay you anything more, because they paid you. But then also working with them to say, hey, can I use that room in there to do a training that I've developed, or I have a evidence-based program that I would like the church to engage in, can I use that room? So everything is not about the payment, but also thinking about that non-monetary, things that you could work with some of your network, whether it be some of the church ladies, some of the church leaders, anybody in your network, just working with them to find out what are some other ways that we can come up with a win-win relationship so that we can get the community healthier, and then also take care of each other. Because that's where it's at, y'all. It's really about, if you're good, if you're feeling good and you're healthy, then people are going to look to you as a light or as an example of like, oh my God, like she looks like she's having fun, like, and she looks like she's healthy. So let me figure out what she's doing. And that it's a domino effect after that, on and on and on. One person lights up another one, each one teach one. So what we have here, right after you get finished reviewing the bartering resources, we have the top 10 whys for community health workers. And I really want to point out number 9. Now that's what I'm stressing now. So community health workers generate 7 streams of income by bartering, trading, and investing. So we're going to let that marinate on everybody. So in the comments, I'm seeing a lot of great comments. Thank you for watching. If you're just joining, please like and leave your contact information. Definitely want to leave your contact information in the comment section for Alicia to reach out to you, and also keep in contact with you and make you a part of the network. And also Alicia is saying hourly schedules have really changed my daily productivity. Exactly. We want to say high performance. We want to be at our best. We want to be energized, and I remember years of being just like tired, like, ooh, like I don't know what to do next. But that's not a healthy community health worker. We have to really focus on ourselves, y'all. So I feel like I'm preaching to the choir, but y'all know what I'm talking about. So the 7 streams of income are very important. Just being creative in things that you're working on and doing, everybody, we can get to that 7 streams of income. And we definitely know that, through the social determinants of health, one of the things that a lot of public health folks don't talk about, we talk a lot about these social programs, but we don't really get into the economic stability part. And so, if you're economically stable, then you're gonna have a great quality of life. So let's work on that. So here's some resources. Definitely want to give out a shout out to Ms. Tasha Whitaker, who is actually in Texas. And she has developed a podcast, y'all. So I would say every month, I'm not sure. Tasha Whitaker, I saw you join the live. So if you can introduce yourself on the live and just tell a little bit about, your next episode and when that's going to come out, because I don't want to misspeak, but I want to say you do these monthly, but no, it says 2 days ago, 9 days ago. So she's on a roll at being consistent with these episodes through the CHW Crew podcast. And so what she's doing is interviewing professionals who are working in the community health worker space. And this stretches across the U.S., not just in Texas. And so you definitely want to check out this as a resource and, kind of listen to it before you're going into work to kind of see what's going on. One of the things that I know that's helped me in my business and also my career is just always staying up on the latest, greatest, and always trying to do that thing that nobody else is doing. Like, oh man, everybody's doing this. Let me think of something else to advance us a little bit further. And so these episodes are packed full of great nuggets, gem dropping information. So I definitely want you guys to check out her podcast. A lot of hard work went into that. And I would definitely say start with episode 26 with my good friend, colleague, and my college classmate, of Miss Quisha Umimba, with all of her credentials at the end of her name. She has a lot of alphabet soup. So you definitely want to check out this podcast and just go through the resources, y'all. Just check them out. And shout out to my website, the maintenance resource, Mr. Jesus Medrano Palacios. I'm not sure if he's on the live, if he can introduce himself, but he's the one who actually helped me put together the website. Thank you, Ms. Venice, for helping to bring in some of my interns as paid members of my team. So shout out to Jesus. What he's done here for you guys is develop out a list of training courses through train.org where you can actually go through some preferred recommended trainings that are related to one of the 6 domains. So one of the 6 domains is advocacy. So you only have to take I believe 4 or 5 hours. So it's 30 hours total. So that's 5 hours. So 5 hours in each domain. So all you have to do is pick 5 courses from this list here. And actually, you'll be finished with the advocacy section of the training verification form. So, and usually these classes are about an hour long each. So once you finish them, you'll just document them on your form and you'll just move right on to the second section, which is communication and education. And so you can see some of the courses here. These were highly recommended courses from Ms. Quisha Umemba, who is also a part of the team. I consulted with her on, what are some training courses? What are some things that community health workers need to be thinking about? And so we were mindful in selecting courses that she told us about that are going to be great resources for you guys, so you're in the know. So when you're out talking to your community, they're like, oh my God, you're well informed. You got some good information there. I didn't know all this. So this is cutting edge stuff going on here. So again, check out this podcast where I'm giving some information about my story of how I started off as a secretary, moved into an upper management position at the health department, and finally I was like, hey, I want to do public health on my own. Started my business, and here I am today contracting with the Florida Department of Health in Seminole County, way out of Arkansas. So check that video out. Jesus took some time out to really be thoughtful about the videos that he was including here. Here's some information about foundations of health. We're going to still be working on some of the courses for the other areas and coming up with a list. So stay tuned on the website for new developments. We want to scroll down to the end of the website. Got one more thing I want to share with you about resources. And so, LaTonya is the type of person where I'm always reading, always trying to figure out like, what's a great resource? And so there are 2 ladies that I want to point out to you who are great resources, who've been very helpful in me, developing the content. So Ms. Quisha Umemba, she's the founder of Umemba Health. She has a website. She has lots of training on there. Virtual workshops. So she is a great resource for community health workers. So you definitely want to check her out. And again, Ms. Tasha Whitaker has a podcast within. She's actually working in the community health worker space, has lots of experience, a Facebook group, network with so many community health workers. So definitely check them out as 2 great resources. And again, there's my contact information at the bottom. So where was I? So that's a little bit about the website. So I'm going back to my list of things that I need to talk about that Alicia told me to highlight here. So we talked about the certification process. We talked about the role of a community health worker. We talked about some of the duties, your boots on the ground. You're always educating yourself and staying up on the latest, greatest. So continuing your education and developing out your career and resources, that's going to make you very successful. So the successful community health workers are the ones who are always proactive, always thinking ahead. So, COVID hits, what are you going to do? Your community can no longer meet in person. So how do you connect with the community? And maybe some of them are older and they're not into technology. So how How do you engage them? So, just always thinking proactively on how you're going to continue to serve your population, your demographic that you're working with. And of course, it's a faith-based community here. How to improve health, definitely starting with your own health, making sure you have your screenings done, and you're checking your screening levels, high blood pressure and all of that. Just making sure you're healthy. That's going to encourage other people to be healthier as well. And saving money, on trainings itself, I would say Miss Venice is a great resource to save $50 if you want to go through the certification training. That's a great resource. But there's so many things that we could be doing, but we're just, life happens, y'all. Life it will get in the way. So just always staying in that encouraging mindset of you're doing the best that you can, continue to maintain, but then also find creative ways where you could do more with less. Does that make sense? And then last thing I want to talk about, last two things really, recommendations for the state. So not just for Florida, but for Arkansas, and this goes for any other state. Just recently have states been getting into really standardizing community health workers, because they're seeing that you can have all these people working at the health department all day, professionals with degrees and all this, but when it comes to the community and the boots on the ground people actually who they want to listen to, they want to see a community health worker, because they know that community health worker understands. And not only do they understand, but they have actually lived in the community. They understand the challenges of what it's like to be a local resident in that area. So the community health worker is a great, valuable resource to any health department. So I would say, continue to invest, nurture, groom, mentor, encourage your community health workers, just as you would anybody else at the health department. But I think, speaking from professional experience of being a health educator, sometimes I didn't feel valued. I didn't feel like people actually understood what a health educator was. I was always trying to prove that I had something to offer of value. But once I figured out that I have a niche, my niche is in listening to what's going on and interpreting that information into simple terms. And that is exactly what a community health worker thrives on, is taking all that good information from the health department, all that good jargon, and breaking it down to the simple terms so that your community actually understands it. But the last thing I want to end with, if there's nothing else, Miss Venice, Alicia, you can hit the chat if I missed anything or if I need to cover any additional topics. But the last thing I want to talk about is confidence, y'all. Can somebody type confidence in the chat window? Everybody say confidence. Type it in there. Confidence for me is when I stop waiting for everybody else to do something and I said, hey, I'm going to take charge. I'm going to, yes, Miss Venice, I'm going to take charge, and I might not know everything, but I'm going to do it the LaTonya Bynum way until I figure out a better way. I would say, my confidence really grew when I became a Toastmaster. Toastmasters International, another great resource. Toastmasters International taught me great communication skills, leadership skills, and just learning how to wing it. I took a minute to actually come on this live because I couldn't figure it out. But guess what? I said, I'm going to jump on Zoom and I'm going to send them the link and see if they can share the screen, yada, yada, yada. And look, here we are. It worked out, and hopefully you guys have been listening to me. I don't know if I'm talking to y'all or thin air, but I've been having fun here. But confidence is working through any of your own personal issues so that you can help other people with their issues. I'll say that again. We're going to work through our own personal issues so that we can help other people with their issues. And so I would say a lot of times when I was at the health department, I was always helping, pouring out, like just giving. And I almost forgot to take care of Tanya, you know? So as community health workers, as public health professionals, let's be mindful of taking care of ourselves, like self-care, you know, taking a little break and saying, hey, let me do this for me so that I can be at my best for everybody else. And so confidence is key. Thank you, Ms. Venice. Confidence, confidence, confidence. So that is all that I have as far as the certification goes. Once again, shout out to my team, Quisha, Jesus, everybody, all of my interns, mentees who have joined in, my Facebook community. Thank you so much for joining. This has been a pleasure, and I look forward to working with Ms. Venice and the Seminole County community health workers. If there's nothing else, Ms. Venice, I'll go ahead and close out. Thank you again.